In a unanimous decision from the Texas Medical Board, a doctor was publicly reprimanded for saving a hospice patient's life. Hi, Dr. Brian here, retired physician and founder of Health Without Risk. Today, October 17, 2025, the Texas Medical Board handed down a significant decision publicly reprimanding Dr. Mary Talley Bowden. This action stems from a contentious case in 2021 where Dr. Bowden intervened in the care of a patient a hospital had placed on hospice. The board's decision, based on findings from administrative law judges, cites Dr. Bowden for disruptive behavior by sending a nurse to a facility where she lacked privileges after a family member asked for her help. The patient had been placed on hospice at the hospital, and no further treatment was going to be offered by the medical staff. Administrative judges determined Dr. Bowden's actions were intentional and presented an increased potential for harm to the public. Dr. Bowden stands by her actions, asserting she followed a court order issued after the family sued for patient intervention, and she had a duty to her patient who ultimately survived. She views this as a fight for patient rights and a challenge to the established medical system. I attended remotely, and here's the relevant footage from this morning's hearing.
The proposed final order for Dr. Mary Talley Bowden. This order is, as required by law, based on the PFD, is issued by the judges of the State Office of Administrative Hearings. The board has no authority to change the findings in the PFD, only authority to determine the appropriate sanctions based on the PFD. As background, board staff that Dr. Bowden behaved in a disruptive manner by sending a nurse to a hospital where she did not have privileges. And the judges found 2 aggravating factors and no mitigating factors. The aggravating factors found by the judges: Dr. Bowden's actions were intentional. Dr. Bowden's unprofessional conduct presented an increased potential for harm to the public. Those are the judges' words.
Basically 4 years ago, almost to the day, I got a phone call from Aaron Jones, frantic, Texas Talley Hospital, was talking hospice, wanted to let him die, and she wanted him to try a drug that is now over the counter in Texas, ivermectin. Asked me to help. I did what I could. It was a very complicated legal situation. I testified. We won. The court did not offer Texas Talley Hospital any discretion in whether or not to give me privileges. So I was following a court order. I had a duty to my patient, and that's what I did. I followed the advice of my patient's attorney. I should have probably gotten my own attorney. But beyond that, I have absolutely no regrets. I would do it all over again, without a doubt. I'm actually proud of myself for what I did. And so is a Texas legislator. They issued a resolution honoring me. So going forward, I don't really care what y'all say today. I am appealing. I am suing. I have 2 lawsuits that will be served probably next week to the board, to members of the board individually. I will be working on legislation so that this never happens again, because patients should not have to sue to get a second opinion. It's absolutely ridiculous, especially during a pandemic where doctors were given same-day privileges. If they showed up at the hospital and said, I'm here to help, same-day privileges, but not me. And this had nothing to do with ivermectin, right? That's why my deposition, they named ivermectin 86 times. Let's just say, Mr. Jones wanted to get a second opinion. Just bring Dr. Bowden in for a second opinion. Well, still, he had to sue, and they wouldn't let me do it. I had a clean record, no malpractice, never been in front of the board, never thought this would ever happen. So I don't really care what y'all say. This is going forward. I'm taking it all the way. Thank you.
I move that the board enter a final order that adopts the findings of fact and conclusions of law recommended by the administrative law judges in the proposal for decision. I further move that based on the findings of fact and conclusions of law, the board issue a public reprimand, and the public reprimand is the only term in the final order.
Thank you, Dr. Quinones. The motion's been made. Is there a second? All those in favor, please say aye.
Aye.
All those opposed? Those who are virtual, we got that too?
Yes, I believe we got everyone's votes in person and virtual.
All right, motion passes. Thank you.
Thank you.
All right, that concludes agenda item number
Dr.
4.
Bowden has stated her intention to appeal this decision, pursue legal action against the board and its members and the Federation of State Medical Boards, as well as work on legislation to ensure patients can more easily access independent medical consultations. This story raises profound questions about medical autonomy for physicians, patient advocacy, and the oversight powers of regulatory bodies. What are your thoughts on this unfolding situation? Do you agree or disagree with the Texas Medical Board's decision in this case? Do you support a patient's right to a second opinion if they choose to make that request? Let us know in the comments. Like and share this video, and don't forget to follow Health Without Risk, where we explore options for better health you may be prohibited from by medical boards and mainstream medicine. Thanks for watching. Bye.